Hello, everyone, and welcome to the Deep Dive. I'm so glad you could join us today for Dentist's Coffee Time. Today, we're going to dive into something really fascinating. We're sort of decoding what's being called the Asian aesthetic curve. We're going to be exploring this intersection of culture, global media, and the actual science of what makes a face look harmonious. Our main focus is going to be the side view of the face, the lateral profile, and how ideas about beauty, especially around lip position, are changing, and changing fast. We're digging into some really specific research that looks at what young adults in places like Korea and Japan, places with huge media exposure, find beautiful today. And the goal is to translate those subjective feelings into hard numbers, the actual lines and angles that clinicians can use when planning treatments. This should be fun. So let's start with the basics. When most people think about dental work, they're probably picturing a front-on smile. But for anyone in orthodontics or aesthetic dentistry, the side profile is, well, it's like the architectural blueprint, isn't it? Why is it so important? It goes way beyond just how you chew, right?
Oh, absolutely. The lateral profile is the ultimate test of facial harmony. I mean, we're not just straightening teeth in a vacuum, we're positioning them to support all the soft tissue of the face, the lips, the chin, the cheeks. And that's what really dictates how a person looks in the end. You can have perfectly straight teeth, but if they're in the wrong spot, the profile can look, strained or pushed out or even caved in. When we look at this anatomically, the textbooks talk about the facial profile having three main curves. You've got the first one up top, the forehead. Then the second one is all about the nose. And the third, which is where we come in, is that crucial lower part of the face, the lips and the chin.
And I'm guessing that as dentists, our focus is squarely on that lower part.
That's right. The vast majority of our clinical energy is spent on those lower two curves, the nose, the lips, the chin. Why? Because that's the zone where we can actually make the biggest difference, whether it's by moving teeth, surgery on the jaw, or other procedures. It's our aesthetic playground, really.
Okay, so if that's our playground, what makes a profile look good or, normal? It's not just a straight line from the nose down, is it?
No, not at all. A pleasing profile is all about graceful curves. The single most important feature is a natural concavity.
Like a cavity, so like a little dip.
Exactly. A subtle, gentle dip right under the nose, around the upper lip area. You have to have that for a smooth, natural transition. If that area is flat, or worse, if it bulges out, the profile immediately looks strained. It looks protrusive. And just to be clear on the anatomy, the lip itself has three parts. There is the skin part, the cutaneous part, then the vermilion border, which is the red part where you'd put on lipstick, and then the inside, the mucosa. When we're talking about the profile, we're really focused on that smooth outer curve made by the skin and the vermilion.
Okay, but in clinical work, you can't just eyeball a nice little dip. You need numbers. How small are the changes you're actually measuring here?
They are tiny, and they're critical. We're talking millimeters. So let's look at two key measurements that define that lower curve. First, that concavity right below the nose. We measure its deepest point. And statistically, the normal depth for that little indentation is, well, it's just 1 to 3 millimeters.
1 to 3 millimeters. That's it. That's an incredibly narrow window for what's considered normal.
It is. It's a tiny target. And it's what gives the profile that relaxed look, not too full, not too strained. If you miss it, you risk creating a face that looks too puffy or convex.
That brings up a good point. With a target that small, how do you even measure it reliably? I mean, what's the margin for error?
That's a great clinical question. A 1 to 3 millimeter measurement is super sensitive. The patient's head position could change it. The operator could measure slightly differently. This is why we rely on standardized x-rays, cephalometric films, which use the skeleton underneath as a reference. You have to remember, these are population averages.
So if a patient is at, say, 3.5 millimeters, you don't just immediately say something's wrong.
Exactly. It's not automatic pathology. It's a flag. It tells you to look deeper, maybe check the angles and ratios, which are often a bit more robust than just a linear measurement in millimeters. The second key measurement is what we call the mentalabial fold. That's the little depression between the lower lip and the chin. The normal depth here is a bit more forgiving. It's statistically 4 millimeters plus or minus 2. So a healthy range is anywhere from 2 to 6 millimeters deep.
Okay, so that fold is what separates the lip from the chin. And if it's too shallow, I guess the lip just kind of blends into the chin.
Precisely. And if it's too deep, it looks sharp and strained, which we'll definitely get into later when we talk about specific bite problems.
So these tiny little measurements, these folds and dips, are really the secret to a balanced profile.
They are. If they're missing or really exaggerated, it's a huge clue that there's probably an underlying skeletal or bite issue that's putting stress on the soft tissues.
You mentioned reference standards earlier. Can you talk a bit more about how Even a simple term like lip height can get complicated.
Oh, definitely. It's a classic trap. Take lower lip height, you look in one textbook, and they measure it from the edge of the lip down to that mentalabial fold we just talked about. They stop right there. But then you pick up another book, and their definition includes the entire chin area, all the way down to the bottom of the chin.
And if you mix them up,
You're in trouble. If you measure your patient the second way but compare them to the first standard, your numbers will be way off. You might misdiagnose the whole case. It just shows why having a consistent, well-defined reference standard is everything. And that's really why things like the E-line were created, to give everyone a common language.
perfect transition. Let's talk about that common language. The aesthetic line, or E-line. This is probably the most famous measuring stick in orthodontics. Where does it come from?
It was developed by Robert Ricketts, and its beauty is its simplicity. It's
Yeah.
just a straight line. You draw it from the most forward point of the tip of the nose down to the most forward point of the chin.
So nose tip to chin tip. And what are the technical names for those points?
The nose tip is technically the soft tissue nasion, though some just call it the pernasale. And the chin point is the soft tissue pagonian, or PG prime.
And those 2 points, the nose and the chin, they really define the whole structure of the lower face, don't they?
They do. The nose is influenced by the nasal bones, and the chin's prominence is directly related to the jawbone underneath. So by connecting those two dominant features, Ricketts created this amazing reference plane. It lets us judge the position of the lips against the overall architecture of the face.
So the big question is always, where are the lips in relation to that line? Are they in front, behind, or right on it? And the answer, historically, was very different depending on your background.
Completely different. Let's start with the traditional Western or Caucasian standard. In that population, the ideal was for the lips to be positioned significantly behind the E-line.
So you get negative numbers.
Right. And that's because Caucasian populations tend to have, on average, more prominent noses and, really importantly, stronger, more forward-projecting chins. Those two features push the E-line forward, leaving the lips further back. If you look at the numbers, the upper lip in that classic norm is somewhere between -4 to -6 millimeters behind the line. The lower lip is a little less, maybe -2 to -4.
That's a lot. That creates a very straight, almost flat profile, visually.
It does. The nose and chin are the stars of the show, and the lips are more recessed. It gives that perception of, refinement.
Okay, so now let's pivot. What about the traditional data for Asian populations, like the Japanese and Korean adults in this research? How different was their classic profile?
It was dramatically different. Traditionally, Asian profiles were known for having more protrusive lips, which created a more convex facial shape overall, and this comes down to the skeleton. The cephalometric data from that time showed that these groups often had, on average, less prominent chins and teeth that were tipped more forward.
So you have a chin that's further back and lips that are further forward.
Exactly. The chin being back pulls the E-line backward. The lips being forward pushes them forward. The result is that the lips end up much closer to the line, or sometimes even a little bit in front of it.
Which means their measurements would be close to 0 or even positive numbers?
Precisely. If you look at the old data, for Korean adults, the lips were right on the line. Men were at plus 0.7 millimeters, women at plus 0.2. And for Japanese adults, it was very similar, men at plus 0.3, and women were actually a little more protrusive at plus 0.9 millimeters.
So you compare a plus 0.9 to a -6. That is a massive ethnic difference in what was considered the norm.
It's a stark difference. One profile accepts and is defined by a gentle convexity, while the other demands a much flatter, straighter look.
Which sets up the central question for our deep dive today. If that convexity was the traditional norm for Asian profiles, is it still what younger generations, who are so connected to global media, consider beautiful?
And that is exactly the tension that led to this really important study from 2008.
Right, the one from the American Journal of Orthodontics and Dentofacial Orthopedics. So why did they focus specifically on young adults from Korea and Japan for this?
It was a very deliberate choice. First, they share a similar racial and cultural background, but the most important factor was their intense exposure to global mass media. We're talking Hollywood movies, Western fashion, the internet, Hallyu culture spreading everywhere. The researchers had a hypothesis that this constant stream of international beauty ideals, which, as we just said, are usually much flatter, would start to change what people found attractive, maybe even overriding their own traditional ethnic norms.
So they were trying to see if a global consensus on beauty was starting to form, But how do you even measure something as subjective as beauty? What was their method?
It was very clever. They used standardized soft tissue silhouettes,
Yeah.
just the black outline of a profile.
So you take away all the distractions like skin color, hair, all of that.
Exactly. It forces the person rating it to focus purely on the shape, the form. They started by creating an average face. They took x-rays of 30 Japanese adults with what was considered a normal bite and used a computer to merge them into one average profile. They called this profile number 7.
So number 7 was the baseline, the traditional ethnic average.
Yes. And from there, they created a whole lineup, 13 profiles in total. Number 7 was in the middle. Then they digitally moved the lips step by step in 1 millimeter increments.
Forward or backward?
Both. So profile number 1 was the most retruded. The lips were pulled back 6 millimeters from the average. And profile number 13 was the most protrusive, pushed forward by 6 millimeters.
So they had this whole spectrum, from very flat to very full. And then who did they ask to judge this lineup?
The judges were young Korean and Japanese dental students, the idea being they were both part of the target generation and also have a trained eye for facial features. They were asked to pick their top 3 favorite profiles.
Okay, so this is the big reveal. What did they pick? Did they pick number 7, their own ethnic average?
Well, this is where it gets fascinating. No, they didn't. There was an overwhelming trend from both the Korean and Japanese students to pick profiles that were significantly more retruded than their own average.
Wow. So they were actively choosing the flatter look.
Very actively. For the male profiles, the top picks were numbers 5, 6, and 4. Profile number 5 was the runaway favorite. That means their ideal male look had lips that were 2 millimeters more retruded than the average.
And what about for the female profiles? Was it the same?
For women, the shift was even more pronounced. It was more dramatic.
Really?
Yes. The most favored female profiles were numbers 3, 4, and 5, with numbers 3 and 4 being the top contenders. That means they preferred a female profile that was 3 to 4 millimeters more retruded than the average Japanese woman's profile.
Wait, that's a massive finding. So the preference for a flatter, more Western-influenced look was even stronger when judging female beauty. What does that suggest?
It suggests the aesthetic pressure isn't symmetrical. The modern ideal of feminine beauty in these societies seems to be moving even faster towards that flatter, more refined profile. It's often tied into that cultural concept of the small face or the V-line jaw. A protrusive mouth can make the lower face look larger, which is currently seen as less desirable in a lot of high fashion and media contexts. A more retruded lip position visually minimizes that area.
So the implication for a clinician today is just huge. If you aim for the traditional average, profile number 7, you risk giving your patient, especially a young female patient, a result that she might feel is too puffy or protrusive.
That's the warning, loud and clear. The statistical average of how a population looks may no longer match up with their aesthetic preference. Culture is literally reshaping the standard of beauty, and we have to adjust our treatment goals to match.
Okay, this is the really crucial part for any professionals listening. We've seen the subjective shift. Now let's turn those preferred silhouettes profiles 3, 4, and 5 into hard clinical numbers. What are the actual targets we should be aiming for?
Right. Let's get into the specifics. Let's start with the E-line again. Remember, the traditional Asian numbers were around 0 or slightly positive. The new preferred ranges show a shocking shift into strongly negative territory. For men, the preferred range for the upper lip is now minus 5.5 to minus 3.5 millimeters. For the lower lip, it's minus 2.0 to 0 millimeters.
Let's just pause on that. Minus 5.5 for the upper lip. That's deep into what used to be considered the traditional Caucasian norm. That's a fundamental change in the desired facial structure.
It's a complete paradigm shift. It means we're moving from a slightly convex ideal to one where the upper lip is clearly and substantially behind the nose-chin line. And for women, the shift is just as dramatic. The preferred upper lip range is minus 4.5 to minus 2.5 millimeters, and the lower lip is minus 1.5 to plus 0.5 millimeters.
So even for women where the average was slightly protrusive, the new ideal is for both lips to be safely behind the E-line.
Correct. The takeaway is clear. If you're treating a young Asian adult today who is concerned with aesthetics, your goal should probably involve significant lip protrusion compared to the old standards.
Okay, let's move from lines to angles. What about the nasolabial angle? That's the angle between the base of the nose and the upper lip. How does that change?
Well, it correlates perfectly. A protrusive lip creates a smaller, more acute angle. A retruded lip opens that angle up, making it more obtuse. The new preferred ranges are for men, 94 to 96 degrees. For women, it's 100 to 102 degrees.
Ah, so it's a wider angle for women, which again supports the finding that the preference for a flatter upper lip is even stronger for females.
Exactly. That wider angle is the geometric expression of that flatter profile. Clinically, getting that angle right is all about controlling the position of the front teeth.
All right, now for the big one, the master indicator of the whole profile shape, the Z-angle.
The Z-angle is vital. It measures the whole chin-lip line against the Frankfurt horizontal plane. It basically tells you how convex or straight the face is overall. The preferred ranges here are, for men, 72 to 75 degrees, and for women, 73 to 75 degrees.
And how does that compare to the historical Asian average? That was lower, right?
Yes, the historical average was more in the 69 to 72 degree range. So this increase to 75 degrees confirms, yet again, the preference for a straighter, less convex profile.
But, and this seems really important, the Caucasian norm for the Z-angle is way up around 80 degrees. So even with this massive shift, the new Asian ideal of 75 degrees still falls quite short of the Western one. Why is that? Is there a limit?
That is the absolute key question. This is where aesthetic desire runs into biological reality. That 5-degree gap between 75 and 80 is huge, and it comes down to the underlying bone structure. Many Asian populations, skeletally, just have a different architecture, often a maxilla that's a bit more forward and a chin that's a bit less prominent. To get an 80-degree Z-angle, you need a really strong forward-projecting chin to pull that reference line forward. If a patient doesn't have that bony chin, you can pull the teeth back all day long, but you're not going to change the bone.
So to truly hit that 80-degree mark, you'd need more than just braces.
You'd be in the realm of orthognathic surgery, a genioplasty to advance the chin, for example. So this preferred 75-degree angle really represents the sweet spot. It's the flatter look you can achieve orthodontically while still respecting the patient's natural skeletal framework. It's a straighter profile that still retains a degree of natural ethnic convexity.
That's a critical point for setting realistic expectations. Okay, so we've mapped out the new ideal. But in the real world, you're mostly dealing with profiles that are far from ideal. Let's talk about the abnormal contours. How does that mentalabial fold, the chin-lip crease act, as a diagnostic sign?
It's an amazing barometer for problems. Remember, the normal angle is a nice, soft, obtuse angle around 120 to 140 degrees. When things are wrong, that angle tells you a story. So first, let's look at an open bite profile. This is often where the front teeth don't meet. These patients really struggle to get their lips together. It's a constant strain.
And what does that muscular strain do to the chin?
It creates chaos for that smooth contour. To force a seal, the mentalis muscle in the chin just goes into overdrive. Instead of that one gentle, smooth fold, the skin on the chin gets all bunched up and puckered. You might hear it called an orange peel chin. The source material we looked at points out that this hyperactivity can actually create two distinct wrinkles or folds there.
So if a clinician sees that double fold, that's a red flag.
It's a huge red flag for a vertical problem. You should immediately be thinking about a skeletal open bite or something else that's forcing the patient to strain their lips to close.
Okay, now for the other end of the spectrum. The deep bite profile, often seen in Class 2 patients where the lower jaw is back. What happens to the mentalabial fold then?
It's the complete opposite. In a deep bite, the lower lip often gets kind of trapped behind the upper teeth, and it's forced to curl inwards and upwards. This creates a really sharp, acute fold. The mentalabial angle decreases dramatically. It often drops way below 90 degrees.
And what does that sharp 90-degree angle tell you?
It's a powerful indicator of a problem with what we call the VPO, the vertical position of the occlusion. It suggests the vertical dimension of the lower face might be collapsed or insufficient.
So you mean the bite is too closed down?
Exactly. It's too short vertically. When you see that super sharp angle, the treatment plan often involves trying to increase that vertical dimension. You need to open the bite up to allow the lower lip to unroll and assume a more natural, relaxed position.
So it's two clear visual cues. A messy double fold suggests too much vertical height, an open bite. A sharp, acute fold suggests not enough vertical height, a deep bite. It really highlights why that normal, smooth fold is so important. This has been an incredibly detailed breakdown. It seems the final conclusion is that the aesthetic ideal for young Korean and Japanese adults has just gone through a massive, measurable shift. They're moving away from their traditional, more protrusive ethnic norms towards a profile that's significantly flatter, more retruded, and much closer to a globalized media standard.
And it's an actionable shift. We have clear clinical targets now. Lip positions that are negative to the E-line, Z angles in the 75-degree range, wider nasolabial angles. These numbers give clinicians a modern roadmap to meet what patients today are actually asking for. But, and this is probably the most important point of all, we have to remember the caveat from the study. These statistics are guides, not commandments. You can't and you shouldn't treat every single patient to the exact same numerical ideal. A patient's individual desires have to be the #1 priority. Someone might come in and specifically say they like their fuller lips, they want to retain their natural ethnic convexity, and we have to respect that.
That's the perfect place to leave our listeners with something to think about. Given that these beauty standards are so clearly and so quickly being shaped by global media, what is our role as clinicians? Is it to follow the trend and help patients achieve these statistically favored, flatter profiles? Or is it to balance that with respecting a patient's natural features and, maybe most importantly, their own unique sense of self and individuality? Where do we draw that line? Thank you for listening to the Deep Dive on Dentist Coffee Time. Goodbye for now.